Nursing is this, nursing is that, nurses are this, nurses are that. Enough is enough. Hello everyone and welcome back. My name is Fab, and in this video I'll be debunking some nursing myths that I've seen or come across while studying nursing and during my clinical postings. So first of all, start with what nursing myths are. Nursing myths are the misconceptions, stereotypes, or inaccurate assumptions about nursing profession, about nurses, and about nursing practice as a whole, and they are perpetrated through various channels including media, social norms, and cultural expectations. Why do they still exist? Generally, I would just say it's due to lack of understanding, because if you're studying nursing or you have someone studying nursing around you, or if you're a nurse or you have a nurse around you, you will know that the statements are not true. So I would like to start with the fact that people say nursing is a low-skilled profession. You don't say. The level of education and training required to become a nurse is a lot. The complexity of nursing skills and tasks is a lot. The critical thinking and problem-solving skills required in nursing practice. The impact of nursing care on patient outcome and healthcare systems. How are all of these low-skilled? It takes 5 years in university studying nursing. No holiday, clinical posting, reading back-to-back, dealing with real-life patients to be able to practicalize what we've learned in theory, because nursing is not just about theory. You have to actually practice out what it is that you learned. And for the critical thinking aspect, the level of thinking that it takes in actual world, in actual clinical environment is a lot, because you have to be thinking 24/7. Okay, well, this patient is diagnosed with this. This is the drug that is to be given to the patient. This is the monitoring that is supposed to do, and the steps you're supposed to carry out to care for this patient. Thinking about that, and it's not just one patient you're thinking for. You're thinking for about 2, 3, 4, depending on the number of patients that are in your ward at the time of your shift. So the level of thinking it takes as a nurse, you must be smart. If a problem arises, what do? Not everything that you read or learn theoretically. There are some things that you have to actually experience it, know about it, and to actually know what to do. So nursing is not low skilled. You have to be able to think yourself and connect the dots when you are already in the clinical environment. It takes a lot of thinking to be able to do that. Nurses stay with patients to be able to develop nursing care plan to aid great outcome. Nursing care plan is like a system in which nurses use to care for their patients in the ward, where they will assess their patient, they will diagnose the patient, then they will now plan on how to care for the diagnosis that they made, and then the implementation, that is what they will carry out to do. And then evaluation is like checking back on what it is that you did. Did it work? Did it not work? Did you meet up with the time range that you wanted to meet up with, and all of that? So all of this takes critical thinking and high level of problem solving skill. So all these aren't low skilled at all. I've always wondered how somebody who is sick or maybe involved in an accident gets well through medical treatment. Well, my experience during posting actually showed me, especially in A&E, which is like the first point of contact for patients, that your brain actually needs to be working 24/7, like literally every millisecond, for all healthcare, including nurses. Because 2 or 3 patients can be brought in at the same time, and you have to ensure proper treatment for each one of them. And how do you do this? Like through triage, and you prevent as much casualty as possible, from vital signs to control of bleeding, to prevention of infection, to proper positioning, to writing of reports, to close monitoring, to ensuring proper drug administration, to a lot of things till they are eventually discharged. So I hope with this few points of mine, you now believe that nursing isn't low skilled. Kindly share your thoughts in the comment section. To my fellow nursing colleagues watching, let me hear your thoughts and experience on this topic, or any other myths that you would like to debunk. Kindly engage this video. Don't forget to like, comment, share, subscribe, and hit the notification button as well. Thank you.